anterior clinoid process. And what is here? You see in colored, in red color, blue color. What is that? In front, this is a chiasmatic groove. Sulcus prechiasmaticus or chiasmatic. Chias means what? Cross. A nerve, the optic nerve for the eye, comes out from the orbit. This is here. This is the optic canal. Inside the optic nerve, comes out here and makes here a cross. Cross means in Latin chiasma, crossing. So, and the groove of the same name. So why I mentioned the anterior border is the boundary for the anterior cranial fossa. So if we connect now free posterior border of the anterior clinoid process and here the anterior boundary, they belong here now to the anterior, separate anterior cranial fossa from the posterior cranial fossa. Okay, now we can say what is in the anterior cranial fossa. What is that here? Frontal crest. This is the frontal crest. Frontal bone, are we the frontal bone? Okay, neyse. This is a frontal crest. What is that here?
This is now.
It's calvaria. Scalpel. What is that here? Foramen cecum, cecum. It means blind. It's closed. Was primarily open for emissary vein. Can be closed. It's closed here. And then here, what is that? Projection. Crista galli. What means gallo? Means cock. Moros. Cock. The cock has that projection here on the head. The crest. Crista galli. Therefore the name Crista galli. What is that structure here? Pierced, having holes. This is the ethmoid bone. Has what? Has a horizontal plate, a vertical plate, and two on both sides. Labyrinths. What are the three parts of the ethmoid bone?
Two labyrinths. And
Two labyrinths,
and
horizontal and perpendicular plate. So the horizontal part is pierced, is named cribriform plate, lamina cribrosa. And this is like elek. Eleğin İngilizcesi ne? Biliyor musunuz? Elek. We used to
balance.
no, not balance. When you have flour in the kitchen, you put it to make.
Yeah.
This is
Correct.
what is that?
Understood.
I understood that. Ne diyor?
Yeah, like the oil when you are trying to
The oil is not,
drain
but
the oil, drain the oil.
not the oil, but if you have powder, yeah, like flour or.
Bunu anladım.
Right.
Bunu dediği,
Pour it, maybe.
you have to make it pour. It pours down the
Yeah.
holes. So you have a plate with several holes.
Yes.
Aha.
Yes.
What is that in English?
Mankalya.
I don't know. I forgot. And I look, but so this is cribriform means lamina cribrosa. Therefore, why we have such a thing there?
Pour
It
the
makes
blood.
you see. This is here nasal cavity inferiorly,
Yes.
and the nose is for what sense? Smell sensations.
Yes.
And we have nerves, the olfactory, the first cranial nerve for the smell sensation, and the fibers. Logically, here comes the smell, the molecules. You do the smell sensation, and the nerves go through the
Purifies
foramina, through the lamina, and reach the brain. These foramina are for nerves, for the smell sensation. Therefore, connection of the anterior cranial fossa with the nasal cavity. Okay, what else we have? We have the frontal bone, the lesser wing here. Now our next depression, middle cranial fossa. What is the posterior boundary? This is, what is that? Sharp projection here, margin. This is margo superior pars petrosa. Margo means what?
Marginal.
Margin, kenar, margo superior pars petrosa. And if you go here medially, this is the dorsum sella. So behind we have the posterior cranial fossa, because the questions may come. Which of the followings are located in the anterior cranial fossa? So you have to know the boundaries.
Yes.
Which of the followings are located in the middle cranial fossa or posterior cranial fossa? Now this margin, now to make it much more clearer, here this is the temporal bone. Here is anterior, here is posterior, medial lateral. Squamous part. Here we have the tympanic part. Here the tympanic part. And here the petromastoid part. You see this petros part, stone. Petra means in Greek stone, hard, like a rock. So this is the petros part, and this is the mastoid process. Together, petromastoid part. And you see it's pyramidal shaped. Look at that, like a pyramid. So it has, in normal anatomical position, I have here an anterior surface, posterior surface, and here an inferior surface. And of course, these three surfaces are separated by margins, logically. This is the now margo superior pars petrosa. And here I have the anterior one between squamous part and anterior surface, and between the posterior surface and the inferior surface, this is the posterior margin. Now, that superior one, you see it's very prominent, and this is the boundary. And there is, you can see it's colored with blue or gray. Here, gray. Gray means here, or blue, what? This, here we have something, a groove. Groove for the superior petrosal sinus. Is that clear? Sinus. What means here sinus?
Pockets. Like small foramen.
No, not pocket. We have two types of sinus, remember. Maxillary sinus or frontal sinus. These are air-filled sinuses. Inside is air. But this is not air-filled sinus. The one is cavity here inside that bone, or here. Space, a room, but not a space, a room. But this is not a room. Here we have, why it's colored with blue or gray? To indicate here we have running a vessel. These vessels are named sinuses, but venous sinuses. These veins are dilated. These are specifically we are going to find here also in the heart, for instance, when a vessel, a vein especially, is dilated, larger diameter, we name it sinus. And these sinuses in the cranial cavity, they collect the whole venous blood of the brain. They are so big channels, you see, and cause on the bone canals. Therefore, the names derive from these sinuses. What is the name of that one here now? We have learned that here. Can you see? What is the name here? Here we have also in continuation. What is that? Groove. Do you remember? Oh, occipital bone here. Look at here. What is the name of that groove? Have you learned that?
Jugular.
Jugular is foramen. We'll come to that. This is groove, sulcus, oluk, for the transverse sinus. Do you remember? Groove for the superior sagittal sinus. Groove for the sigmoid sinus. So look at that, they are connected. Superior sagittal sinus, transverse sinus, sigmoid sinus, and comes to the jugular foramen. Now these are veins, and the veins follow that pathway, collecting the venous blood here alongside, coming to the occipital bone, transversely running, continuation, the sigmoid, finally coming to the jugular foramen. And this sinus then continues as a vein. And the name of the vein is jugular vein. And jugular means throat or neck. It runs in the neck, jugular notch here on the manubrium. All they have to do with neck. So now this is that venous blood collecting dilated veins sinuses. Okay, now it's clear. And now we have one, you see this is not so big one. Here we have the superior petrosal sinus. And that empties also, you see here comes as connection, because the blood must be directed towards that sigmoid, finally to the internal jugular vein. This is that vein that collects all the bad blood from my brain will go, of course, to the heart. So therefore this sinus. Okay, now that was the boundary. Now you can tell me what structures, who can say what structures are located in the middle cranial fossa? As I mentioned the boundaries, who can say? Söyleyin, evet, Esra'mız. The sphenoid, which part of the sphenoid bone here we have? This is here. This is what part of the sphenoid bone is that? Where my finger is. This is the body. This is the body of the sphenoid bone. What does it look like, the sphenoid bone? Butterfly. Wings, body, two wings, body and legs. So in the middle, the body. It's logic. This is the body in the middle. And from there going the wings. Greater wings, lesser wings. And the legs are this. Pterygoid processes. Onwards directed. Okay, now this is the body. The body is cube-shaped, having 6 surfaces. So the superior surface, here there is that depression. What is that here? This is so famous. Turkish saddle. Sella turcica. Sella turcica. What does that mean? Sella? Saddle. What is saddle? Where you put the saddle on? Horse, yes. And it looks like, look at that. Having these two anterior-posterior elevations. Dorsum sella, tuberculum sella. This is the dorsum. And here is tuberculum sella. On the dorsum we have these clinoid processes. And in the middle you can see the hypophyseal fossa. Like that. What is located here? Hypophysis, a gland, hypophyseal gland producing hormones. Pituitary gland. Hypophysis, basically. Okay, now, what other structures we have? What is that?
Foramen ovale.
Foramen ovale, good, okay. What is that here?
Rotundum.
Rotundum means round, yuvarlak, round foramen. And what is that here?
Spinosum.
Spinosum. Very good, these 3 foramina. Then, what is that here? Foramen lacerum. Lacrima means tears. Lacrimal gland, lacrimal fossa, lacrimal bones. Lacrima means tears. You cry. Okay, this is that. Lacerum means it's tear, torn. Here we have normally in a living we have here cartilage. This is filled with cartilage. So what is that here now? Where is inside? Carotid canal. What is that for? If you look here, it's in red color. This is also here. Carotid artery. I mentioned the vertebral artery, remember. It runs through the vertebrae. We discussed that. And now the second artery to supply the brain, this is the carotid artery. What it makes? Here, this is the inferior surface. Here is the inferior surface. Or here, let's look here now. On the inferior surface is the opening, apertura externa canalis caroticus. Okay. You enter the canal that goes up, horizontal, medially, and you are inside now. This is the internal opening of the carotid canal. And that canal is, question, carotid canal is located on which bone? Now which bone is that? Look at, exactly, just look at. Temporal bone, it's on temporal bone, it's on the temporal bone. Here, on the, this is the external surface opening, and this is the internal opening. This is the petros part. In the petros part is that canal, carotid canal. Okay, now, and then The artery continues. There is a groove here. This is the carotid groove on the sphenoid. Lies and then gives the branches for the brain. Next, now the posterior cranial fossa. Oh, one more thing. Okay, what is that here now?
Superior orbital fissure.
Superior orbital fissure. It connects, now we can say, superior orbital fissure. One question, is between point, point, point and point, point, point?
Orbital surface.
No, it is between lesser and greater wings of the sphenoid bone. It connects middle cranial fossa, point, point, point. Where is now? Look at here, where is?
The eyes.
What is that socket mean? Orbita. So, fissura orbitalis superior connects orbita with middle cranial fossa. Will be the questions like that. Okay, now. Then, optic canal connects. What connects the optic canal? What depressions or fossa connects? Orbit with what? What is here? Middle cranial fossa. Because we said the boundary is here. And it remains that canal remains where? In the cranial fossa, the opening. And goes where? Opens to the orbit. The foramen of the optic canal is in the middle cranial fossa. Let's discuss the posterior cranial fossa. What is that here name? That slope here. Where my finger is not. What is that? What's the name? This is clivus. Clivus means yokush, so slope, goes upwards. And it is formed by two bones, sphenoid and occipital bone. Okay? Sphenoid and occipital bone. Okay, what is that? Now, hypoglossal canal. Canalis nervi hypoglossi. What means glossa? Bitti mi gittiler? Dışarıda ara verdiler herhalde. Are they coming? Okay. Yoklama orada. Hypoglossal canal. What means glossa? Glossa means tongue. Tongue. And that nerve comes out from the cranial cavity, goes to the tongue, and supplies the muscles. I can speak, I can use my tongue because that nerve is okay. Because that nerve supplies.
The name?
Hypoglossal.
Hypoglossal.
And glossa is tongue.
Yeah.
Because that nerve supplies the tongue. Therefore, and the name of the canal, therefore, canal for the hypoglossal nerve, canalis nervi hypoglossi. Okay, what else we have here? What is that now? Jugular foramen. Jugular foramen. This big foramen also for the internal jugular vein. Okay. What is that here? What is that? It goes to the inner ear. The temporal bone is that bone which houses the ear. Okay, so this is acoustic means auditory. This has to do with the hearing. And this is the opening for a nerve.
Superior.
Porus acousticus internus, because we have here the external acoustic porus, tympanic part. Okay, now this is also in the posterior cranial fossa. Yes. Now I said at the beginning of the lecture, the canals are important, not important, especially the three canals of the temporal bone, to show you. The one we discussed, carotid canal, then we have the two other, facial canal and canalis musculotubarius, musculotubal canal. So first, the facial canal, canalis facialis. Why the name of the canal facialis?
Because it's applied
Face. It supplies the muscles, the mimic, laughing. All these mimic expression muscles are supplied by the facial nerve. And here you can see that yellow is that nerve. That nerve is running inside the canal. Can you see it very well? Look at that. Now normal position. What happens? The nerve comes from the brain out. It enters. What is that? Now you know that. This is that foramen I mentioned. Name it. Porus acousticus. This is that foramen. It goes through the porus acousticus internus. What makes it? Goes here, you see, anterolaterally, then curves posterolaterally, and then goes down. Can see everybody? Its extension enters the door, comes in, name porus acousticus internus, then goes anterolaterally, makes a bending, a knee of the, this is named the genu, the knee of the canal, because here gives a branch here, that nerve, makes the knee, goes backwards laterally, and then you see goes down and comes out where, what is the foramen here? It's broken. What is the foramen here?
External locus.